Okay, students. Today's topic school health services. School health services मतलब in means की powerful economy means to raise community health in future generations. School health services it will be powerful to the schools, to the family, to the at the vocational area, to the functional area, then occupational area. It's easy for to get the economical status by the powerful school health services. Also, that raise their physical, mental, social, and spiritual health, which also help them getting the wages, proper working area, proper place, worker occupational area by getting powerful knowledge. In 1950, the Secondary Education Committee emphasized the need for the medical examination of students in school feeding programs. Because of that, what happened? The medical examinations of the students easily can be done under the 1958. So we can find out some diseases which we can easily observe in school students like anemia programs, anemia related any diseases, then puberty related diseases, full feeding programs. Under that we can assess the malnutrition, obesities, like that. 1960 started the school health committees to assess the standard of health and nutrition of the children. Before that, what happened? The nutrition level was low, and then the school children are not coming because of not getting the proper nutrition, because of not getting the working place for the school. Objectives: to include the healthy and lifestyle that promote their healthy behavior and learns value of the hygiene. They can easily learn about the non-communicable, communicable diseases by the helping regular hand washings, regular lifestyles like naturals, fruits, calamities. To protect against the specific diseases like immunizations will help them to maintain their immunity at the highest level, which promotes their health and prevents from the any diseases. To promote the health citizens' behavior will improve their mental status, improve their hygienic conditions, and improve their immunity. Training of the teacher of health activities, because the teachers is the first persons to contact every day to the networking area to the children's. Because of that, whatever, if the teacher having the training about the health activities of the hospitalizations, about the hand washing, of the sanitizations, about the uh, proper maintenance of the health and growth, that teachers may helpful to the children's and the family also. As with the parents, teachers is in regular contact with the counseling will help them to binding the teachers and parents rapport. And because of that, what happened? The parents can easily tell the teachers about their children's problem also. The teachers can recommend some problems which they have seen regularly in the children's, and they can contact easily to the parents. To promote healthy environment, which they safe water, safe disposal, extra wastewater, and garbage disposal will helpful them to maintain the healthy environment and maintain their healthy lifestyles. Also, which improve their sanitization, environmental sanitizations. By improving environmental sanitizations, they can improve their health in holistic way. Components of school health services. First one is health appraisal. Health appraisal, it means a periodical examination of observation in children by class teachers every day. Because of what happens, the class teachers will observe every day to that particular children. The class teachers will observe some changes, the mental changes, some mood changes, swing changes. Then what happens, they can easily contact the children, easily contact to the parents also. School health committee recommends medical examinations at the time of the admissions for getting the growth and development chart, for getting the weight and height monitoring, and every 4 yearly that will be revised for getting the changes. Health checkup with the school persons equally important by person's view. Persons will, if they go to health records, what happened? They can be easily find out the disease conditions, what and the changes in that growth monitoring chart. Daily monitoring inspections, like the initially flush face, like if they're having the mood changes, the depressions, and they're having the any bipolar disease, that we easily find out by this daily monitoring inspections. Any races in the children's, any races in the skin, they can be easily find out by daily monitoring inspections. Coughing, sneezing, sore throat, nausea, vomiting, red watery eyes, fever, chills, and headache. This is sign and symptoms from first sign and symptoms of some non-communicable and communicable disease. What will happen? That they can easily find out the suspected disease before occurrence. Sleepy does not want to plates and diarrhea, pediculosis, scabies, and ringworm mostly seen in children because of the communicable, and they are playing together. Because of what happened, the communicable disease easily can transfer from one children to the another children's. So that will be recovered by the daily monitorings. Afterwards, teacher training course subsequently by the sort in services training per year. That will have the records, the previous records. Remedial services measures and the follow-up will helpful for the again and again studies and previous errors that we can find out and we can minimize in future also. Such a clinic should be conducted especially for the schools, at the PSCs, RCH, in the dispensaries for maintaining the school children's growth and monitorings and immunizations. Prevention of the communicable disease, they are providing the immunizations DT at the school's entry at the time of the admissions, and the TT at the 10 years and the 16 years, again the second dose of the TT. They were helpful that immunizations, that helpful that maintain the immunity. Records could be maintained, so the school's parents should be informed in the advance, because if you are not going to inform, what happen? The parents may suffer, or parents may not allow you to provide these TT immunizations. School health environment and minimum standards for the sanitation school have been suggested in the India because of the environmental sanitation. What happened? That improve their playing area, improve their school area, which together and their mind station will improve for school administrations or enrollments. Standard for the schools and locations to be proper approach with the road, should be with the proper approach with the road, because they can easily get the schools. Cinemas, house, factories, railway tracks, markets place should be far because of the noises area. These all are the noises area that may incur their class. School premises will be fences for promoting the security, privacy. In congested area, the near a public park should be made available to the students for playing area for improve their physical growth. Structure should be as far as possible. The building should be single stories, so for improving their physical health, also preventing the diseases like hemorrhages or accident cases. Classrooms vendors should be attached to the classrooms. No class should be accommodated greater than 40 students. Now there is 60 students, but it should be recommended that should be not greater than 40 students, because of what happened. They can easily attentive. They can be easily secure, easily attend the class, and teachers can also easily focus on their particular 40 students. Vendor will help them there for the security purpose. Furniture should be good, so age group according to the age, their height, their weight. Chair should be a backrest for maintaining any back related problems. We can prevent by that providing the backrest. Doors and windows at least 25% of floor area, colors, whites, and lighting should be sufficient for maintaining the eye-to-eye contact. Also, that improves the, also that prevents the from the hypopia or myopia, like eye-related disorders. Water supply should be portable and continuous water supplies that improve their water sanitation, improve their health, reduce the vector-borne or the waterborne diseases. Eating facility, vendors should be not be allowed separate rooms for the midday meal programs. Like for the meal, that be a separate room, like kitchen should be there. That should be far from their class, and vendors should be not be allowed, because of whatever vendors, the children can't able to get the proper nutrition. They are using the some food packets from vendors, and that decrease their immunity and prone to get the diseases like digestive system diseases. Laboratory, one area for the 60 students, one area for the 100, and should be separately boys and girls for the their security purpose. Nutrition services diet should be all nutrition in proper proportions, adequate for maintenance of the optical health. Nutrition disorders could be common in children, like obesity and malnutrition is very common in the someone has the obesity, someone has a short heights, long heights, that we consider as a improper growth chart. Midday meals should be given the proper nutrition status, at least a nourishment meal per the which have the 1/3 of the daily calorie and 1/2 of the protein requirements in school itself. What happens? The school itself is providing the nutrition properly. They can be attentive, they can be concentrative, and then can be gather much more ratios in school. First aid and emergency care should be available training during the teacher's program, like accident, falls, and gastroenteritis and faints and fainting. That will be this is a teacher's training. If they are providing this accident falls to the children, they can easily dress in, they can easily apply the bandages, gastroenteritis, they can easily manage the fluid management, fits and fainting, they can easily check the responses. Because of what? The teachers having the training, teachers have to know about these emergencies can be happen in the school anytime. So they have to ready for the first aid treatment and emergency treatments. Mental health should prevent and drug addictions common in adolescents. For that, they have to provide the psychological support. They have to provide such a guidance. Then this is a crime related activity can be not done by the adolescents, because the adolescence period is what they can easily get some crime. They can easily getting some money by the crime. So they are easily prone to get some crime related diseases, and they can easily prone to get the jail also. There should be a counselors in the schools for maintaining this all the records, maintaining all the adolescence changes, puberty changes, then nutrition changes, and the psychological changes. The counselor should be there. Dental health examination 1 year teaching, so the dental hygienes like proper brushings area. I did early indications of the reflective errors, myopia and hypopia that helpful their maintaining their eye focus, their eyeballs and iris. Treatment to the eye problems can be easily done, that they can easily not want to get the other complication related to eye. Health educations, personal hygiene, postures, environmental health and sex educations will helpful for the maintaining their posture gestures, and the sex education very important for the adolescent girls, because they can be getting the easily get to marry afterward. What happened? They don't have any sex educations, they can easily prone to get the sexual disease also. Education of handicapped children is helping the children to reach its maximum potential, lives an independent life. They have to mentally support, they have to psychological support, that easily can bear the problems, easily they can cope up with the other students who are well, who are normal. So if their mental support is there, they will easy to potential get the independent life by themselves, vocationally and occupationally also. School health records such as be maintained like identification, like their name, address, phone numbers, etc. Past history, like any related histories, changes of the schools, like any disease related changes, congenital deformity related changes, or any body related changes. Physical examinations for getting their growth and monitoring, mainly height and weight and obesities and malnutrition. Immunization history for getting their immunity. These are the useful NSC evaluation school health services provide useful link between home, schools and the community, because if they provide in the home to the school will provide to the community. That is this is the coordinations work. The school health programs and school health services coordinations work, because the children are always come together from the home to the schools and from the community. So they are the first persons can coordinate to this area. In rural health services can be provided with the help of the PSC. Under the PSC school health services, we can organize, we can also provide some nutrition, food packets like biscuits, juices. Also, we can apply some demonstrations classes for maintaining the disabilities, psychological supports. Also, we can organize the camp for blood related changes, for anemia changes, and for the vital organ changes.